This is Wellness by Designs, and I'm your host, Amy Skilton. And joining us today is Wendy Burke, a naturopath who's worked in the space of healthy hormones for quite some time, but is joining us today to talk about a really interesting niche in the wellness space. So, Wendy, thank you so much for joining us on the Designs for Health podcast.
Thanks, Amy. Absolute pleasure to be here. You have been one of my favourites for so many years.
Thank you so much. It's such an honor to be chatting with you today, especially about such an important topic, and that is how we can support our patients who are considering or might already be on GLP-1 therapy. And I know this is a very hot button topic. A lot of people have a lot of opinions about this medication, whether it should or shouldn't be prescribed for this purpose, how it should be used. But I think the reality is that it is being used for weight loss and are being handed out, willy-nilly, if you like, from
Yeah.
doctors to patients who are asking for it. And along with that, there is a lot of unintended consequences, in addition to the intended weight loss that happens along with that. So from our pre-chat, we just should have hit record on our pre-chat because it was such a good conversation.
I know, I could have talked with you all day.
Oh, it was so great. And you're such a wealth of knowledge in this space. And I can't wait for you to share everything that you've learned. But before we dive in, I know some practitioners who might be new in the profession or who might not yet have come across patients and therefore not looked at GLP-1 agonists too closely yet. Can you just give us a little summary of what these medications are actually doing in the body? Because I think everyone knows they're being prescribed for weight loss, but that
Yep.
might be the extent of some people's understanding.
Yeah, sure. So I think what we should probably do is just go back even to a little bit of really early A&P 101, which just is about the gut in itself. So GLP-1 is a substance that is naturally produced in the gut. It's produced in the L cells, usually in the far end of the intestine, and it has a lot of different roles to play. But the one that has gained the most attention is its impact on insulin and blood sugar control. So GLP-1 is released in response to food that we intake, and some foods more than other foods, which we'll have a chat about later. But basically what it does in the body is it slightly slows down gastric emptying. It does help with the hormones in your brain to go, oh, hang on, we're full now. But most importantly, what it does is stimulates the pancreas to release insulin. And this is really where the research was with GLP-1, and it's got a couple of mates also that hang out with it in the enteropancreatic space, and they become important because I think we're going to see a lot of those coming forward in the future of weight loss and diabetic medication. So GIP is another enteropancreatic hormone, similar-ish sort of actions as GLP-1, but also does a little bit more work with lipids. PYY, which also helps our brain go, hey, you're full now, you could stop eating. And amylin is another hormone that's released. It also has some kind of impact on blood sugar regulation. So scientists have known what GLP-1 and GIP in particular have done in the body since probably the early 80s. They recognised that it was potentially a tool that could help type 2 diabetics in particular because of its action on insulin. And so those hormones, GLP-1 and GIP, are called incretin hormones because of the impact on insulin. So if we fast forward how it naturally works in the body, that this is a substance that is naturally made in the body, to where we are now, the difference is one little enzyme called DPP4, because it naturally degrades GLP-1 in the body quite quickly within minutes. So it's a hormone, and like all hormones, it's attaching to a receptor, which is then what the signaling mechanism to every other beautiful thing that happens with hormones. So what the challenge with researchers who are very specifically looking at these pathways in relation to type 2 diabetes was that there's this enzyme called DPP4 that degrades it so quickly. So in around the 80s, a little bit later than the 80s, they came across something called a Gila monster, which is basically a big ugly lizard, really. And they found that this lizard could eat half its body weight, and it would not change its blood sugar regulation at all. And so they found a molecular structure inside its saliva that was molecularly similar to humans' GLP-1. And so what they did from there was they started to work out, well, what would happen if we use this? It agonized rather, sorry, the receptor. And it meant that the GLP-1 basically hung around longer in the body. And so it did more of the actions that it naturally does. Over time and over with science, of course, because technology has just rapidly increased, the structure of that molecule that they created has become more synthesized. So once upon a time, way back in 2005, I think the first GLP-1 receptor agonist was registered for type 2 diabetics. So, I mean, that's 20 years ago. Like this concept is actually not new when we think about it. I guess it's new in terms of hundreds of years, but not new from a science point of view. So once that was registered, then the race was on, obviously, to find out something that lasted longer than 4 hours. And so we then had the next evolution, which was the liraglutides, and they lasted a day. So some people might remember them. That's Saxenda. And then the next evolution from that was the semaglutides, of course, which the most famous is Ozempic, and Wegovy as well. And then the evolution next from that is tirzepatide, and that's GLP-1 and GIP. But basically what I say to people, the very short version is that it agonizes the receptor so that GLP-1 hangs around longer in the body, and it influences an incredible amount of functions all over the body. We have GLP receptors almost everywhere, in the brain, in the muscles. We think they're in our reproductive systems as well, obviously in the pancreas because, insulin. So it kind of accounts for this broad range of actions that we're seeing this plethora of research come now of, GLP-1 can do this, the GLP-1 agonist can do this, it can do this, it can do this. And it's because we have them everywhere in our body. And that was a little bit lengthy, but I love to go back to where did this start? And it actually starts in the body. We have this. And the reason why I always start there is because naturopathically, of course, it starts in the gut, right? Everything starts in the gut. All health starts in the gut. And to me, when I first came across these, that was a clue in how naturopaths can be a part, if they want to be a part, can be a really big part in supporting this cohort of people that choose to take GLP-1s, for weight management or there's a plethora of research that's coming through for other inflammatory diseases as well.
Wow, my gosh, that is just a mind-blowing introduction to the subject. And I feel like I want to take a pause there for a moment. For anyone listening, Wendy works at a beautiful clinic called Soul Spectrum Wellness in North Lakes, and you've really worked in women's hormones and that, whole hormone space. Of course, it's not a leap to go from hormones to GLP-1, but I have to ask, you're the resident expert on GLP-1 now. How did you get here?
How did it all start? Yes.
Yeah.
It is, look, and I love women's hormones. Women, like female hormones, the most interesting thing in the whole world, in my humble opinion. Where I started with GLP-1 receptor agonists is probably partly my own journey, Amy. I lived in a large body for a significantly large part of my life, I would say almost all of my life. And it was when my son was 4 months old, and I had quite a decent case of postnatal depression, lived in put on a lot of weight, was very uncomfortable in my body, was very unhappy, disliked almost everything about me. And what our action plan, my husband and I got together and worked out an action plan. And part of that action plan was to start moving again, to change my diet. And that's actually what brought me into the health space. So I lost a considerable amount of weight. I think it was about 40 kilos all up. So I went, wow, nutrition, everybody should know, everybody should do this. This is like magic. So I went to study it. And in nutrition, like I met naturopaths. Oh my God, herbs, aren't they the best thing ever? So went and studied naturopathy. I got my Set 3 and 4 in personal training somewhere along the way as well. But my interest with GLP-1 very specifically happened because I lived in a larger body. I know what that feels like. And I know what weight bias feels like. And I know what weight stigma feels like. And I was starting to hear just a little bit of judgment from my beautiful naturopathic community about, people who are choosing to take these. And I really felt that this was actually an opportunity for us rather
Mm.
than it being a negative thing. I just thought, oh my God, this is an opportunity for a cohort of people that have tried to, they've almost ignored their health for so long because often they have been, weight shamed by health professionals in the past, or society in general. Like, what a beautiful opportunity to be like a cornerstone of help to a cohort of people that really felt quite ignored by health professionals, actively ran away from them because of
Mm.
experiences that they may have had in the past. And I mean, it's actually showing out in the numbers now too.
Mm.
Reuters Health ran a story last year about people who are returning to, GPs as a start, to have conversations about their health because they were willing to again,
Mm.
whereas they didn't want to in the past. So I'm really passionate about being able to help a cohort of people. And I also think there's so many things like this, our beautiful profession is
Mm.
in the best place to help this cohort of people. There is no other modality that does mind, body, spirit like we do. And that's
Mm.
exactly what these people need. Like the GLP-1s, they're just a vehicle. They're not the destination. The
Mm.
destination is, what's your relationship like with food? What's your movement? What's your sleep? What's your relationship like with self? Where's your joy in your life? Like
Mm.
everything we do every single day. So I
Mm.
just went, I just have to find out everything I can about these medications, help as many people as I possibly can. And along the
Mm.
way, maybe influence some naturopaths to embrace this tidal
Mm.
wave because it's
Mm.
coming. Like we can
Mhm.
stick our heads in the sand and pretend
Mhm.
it doesn't exist, but that's
Mm.
not going to work because there is a
Mm-mm.
tidal wave of meds coming our way. And I
Mhm.
really think that we can help this cohort. Do I accept that the food system is broken and it probably contributed to where we are now? Yep, but I can't fix that right now. But what I
Mm.
can do is help someone be healthy when they take this medication and be healthy when they come off this
Mm.
medication so that they can live their best life in the most happiest way they possibly can.
I love that. I think I understand, as holistic practitioners, the mindset of wanting and hoping to keep people off medication altogether or achieving results in a more natural way. And also, the truth is, people have been, grown up in a society of the silver bullet, and they're just going to do what they want. And sometimes that can actually be a really powerful step in them claiming back their health. I mean, I'm thinking of one client right now who was seeing me for something entirely different, did find that she had leptin resistance and, worked out a strategy to address that. And then in between, appointments where she was on a maintenance plan, she went away, got on GLP-1s, came back and had lost a significant amount of weight, but it didn't receive any support
Mm,
from her doctor because partly they're not qualified to provide nutritional support. They don't have the time, they don't have the resources, they don't have the training. And so these medications are just simply being prescribed and people are having to just wing it really and hope for the best. And typically there isn't any support to optimize it, reduce the chance of side effects, correct any underlying, metabolic or habitual issues that set someone up to be where they are, or even, as you said, help them come off it and having an exit strategy. So there's so much we can talk about and really offer as naturopaths here. And as you said, you're either going to get educated on this to support your patients, or you can allow them to see somebody else who is, because it isn't going to take long if you haven't already seen someone who's on them. It's just around the corner.
mm.
That's for sure. Look, I think the other thing that concerns probably all health professionals, not just naturopaths, but is the side effects of
Yeah.
GLP-1s. And we're going to talk shortly about how you can support someone before going on them, while they're on them, how they come off them. But there also, I want to acknowledge there's a lot of conflicting information around side effects. And I would love to hear what you're seeing as the most current information and why you think there's so much conflicting information out there too.
Such a juicy topic, and
Mm.
I do have many opinions on this.
Mm-hmm.
Um, we'll share the not exploitable ones. So absolutely. Are there side effects? Yes. Yes,
Mm.
there are side effects. I do think that there are many side effects that have been, I'm just trying to think of the right word. Probably, I don't want to say blown out of proportion because I feel that's a really underrated word, but I do think that there have been components of marketing strategies of perhaps other competing companies,
Mm.
pharmaceutical, natural medicine, or otherwise, that have taken pieces of information out of studies and really not taken everything else in it. So,
Mm.
I think look, I'm fairly pragmatic about most things and I do like to research. So, I've sat down, I've looked at the research, especially about the serious side effects, and I've looked at the marketing from people who are absolutely emphasizing the serious side effects. And I can't help but go, I wonder where the money trail is. Like,
Mm.
I think, let's be honest, right? We are in a capitalist society. We also know that this is drug companies that are pushing the GLP-1 receptor agonists through GPs. I
Mhm.
accept that. I absolutely do. But let's not forget that there is a slew of other companies that are pushing their own barrow in
Mm.
relation to weight loss and pharmaceuticals. And I think we have to be really savvy about, making sure that the information that we're actually providing hasn't just been relayed from some influencer who also has something to sell. And I think that's the thing
Mm.
that I get really angry about companies that are taking advantage of people like the general public who understand GLP-1 somehow is associated with weight loss. And I think we kind of have a responsibility to even educate our patients what to look for as well,
Mm.
so that they know, what is marketing bullshit and what is actually real. So that was the
Mm.
first thing I would say about that. Be very
Mm.
careful when you're reposting information from sources that you really don't know whether there is actually science based on it and whether there's current research. What are they trying to sell?
Mm.
What I would say is that I've trolled through every piece of research I can possibly find in terms of side effects. And what we'll do is we'll go through like the most common and then the more serious, because there are some.
Mm.
Most common is gastrointestinal. I think that we're all sort of fairly aware of that. Can happen, absolutely. Does it happen to most people? To some extent.
Mm.
That can range from very mild through to quite strong, and they are usually sort of nausea, constipation, diarrhea. Um, Sometimes headaches. And I personally think a lot of that can be mitigated by decent pre-planning. And this is where I think naturopaths can come into it. But we also see it's most prevalent in that titration upwards as well. So in both medications that are available in Australia, both semaglutide and tirzepatide,
Mm.
they are 16 weeks for semaglutide, 20 weeks for tirzepatide to go up to full dose, which, by the way, not everybody needs to get to, but most of the side effects are in that early titration stage. And I
Mm.
said to you, I really truly believe that if there's a bit of pre-planning in relation to this, we can mitigate some of those.
Mm.
I also think, having a conversation, there should absolutely be a conversation about what someone's bowel motions are before they start these. Oh
Mm.
my God, someone who's constipation should not be having
Mm.
one of these until we sort out that constipation
Mm.
because, hello, gastroparesis, right? So
Mhm.
I think, first of all, that can be a way that we can mitigate some of the side effects, but that's the most common. We see incredible changes to appetite, which theoretically sounds like a great idea, but that's how we then get nutritional deficiencies. And I
Mm.
think here's the time to separate what are the side effects of the drug and the consequences of the drug. So a
Mhm.
consequence of the drug is that they lose appetite, which means they're not intaking food, which means then they can have nutrient deficiencies, A, D, E, C, all the Bs,
Mm.
calcium, iron, all that sort of stuff. But that's not a side effect. It's a consequence of losing your appetite. Again,
Mm.
good planning and good support can assist with that. And we
Mm.
do see sometimes skin changes, fatigue, and hair loss. But again, I would say that is a consequence of the fact that nobody feels like eating.
Mm.
GLP-1 does actually impact the hedonic eating center of the brain anyway. So the receptor agonists have a really strong impact on that. It really dials down any of that hedonic eating that people might have engaged in. And I don't know,
Mm.
you mentioned you've got a client on GLP-1. Almost everybody, all of my patients will report that they've lost a craving for, coffee, alcohol, something like it just doesn't, they don't have that craving
Mm.
anymore. And that's partly with what GLP does in the brain. Loss of muscle mass is another consequence. And this is where I get, cranky again. All weight loss will result in loss of muscle mass.
Mm.
So between 15 and 25% in a normal diet and exercise program, around sort of 31% with gastric surgery, and with the GLP-1 RAs between 25 and 40% muscle mass might get lost.
Mm.
Again, planning, right? We do the nutrition right, we get them strength training and moving,
Mm.
then the muscle mass loss isn't to the extent. And this most of this comes down to good planning and good support.
Mm.
In terms of more seriousness, there is an increase in non-arteritic anterior ischemic optic neuropathy, which was really hard to say. Also in diabetic neuropathy. So there is an increase in that, and there has been quite a number of studies that have shown, and that is a serious consequence because that does appear to be irreversible. I might add that it's 14.5 per 100,000 person years. But it is still a risk, and it absolutely needs to be considered, as anything should be considered when we're speaking about ingesting pharmaceuticals, herbs, nutritionals. We should always be looking at the risk-reward ratio. Thyroid cancers, there have been multiple meta-analysis now and analysis, and so far, even though they appeared to increase in my studies, there has not been an increase in human studies, but absolutely all researchers accept that there's only 3 years of data, so we don't know long term. Absolutely don't know. Early on, there was some issues in terms of potential for pulmonary aspiration when there's endoscopy procedures. But if anyone looks at the gastroenterologist and the anesthesiologist sites in Australia, you can see now they actually have procedures in place. So that comes down to making sure that people are aware that they're taking GLP-1 RAs if they're going in for any kind of procedure, because there may be slightly different anaesthetic requirements. For that as well. There was the discussion about whether there's acute pancreatitis, but the literature doesn't seem to play that out as well, although pancreas enzymes can be raised. And there was a whole lot early on about the neuropsychiatric side effects, but so far in the literature that hasn't played out. In fact, often the opposite seems to be the case. So, really from a hardcore, what are the studies saying? There is some that I think need to be taken very seriously, and there are some that we just need to let's just be sensible. And again, it comes down to, can we prep? Can we plan? This is about trying to make sure that people are aware. And this is, I guess, part of my mission as well, Amy, is not just naturopaths, but I really, really want to try and get out and say to people, look, I think that the medications have merit. I think they, well placed, are a wonderful tool in the toolbox, but I really want to make sure that there's some prep done. And if GPs are not in a position to do it, some will, some won't. We all know that the GPs act in different ways, different philosophies, different times that they like to work with. If a GP can't do that, then look, here's some information. Get basic bloods done. Make sure you're not nutrient deficient. Make sure your bowel motions are working properly. Do you have a plan? Do you know what you're supposed to eat nutritionally? Do you have a plan from an exercise point of view? Do you know what the side effects might be? What's your plan in relation to that? So I really think a lot of this can be mitigated. Some of the more common side effects can be mitigated with really good planning. And, because research, right? So there is actually research that indicates that too. So those candidates that have been well placed in terms of planning ended up with that less traumatic outcome. I can't think of the right word, but that's the only way that comes to mind, because they were aware of what the gastrointestinal side effects might be. They had a plan. They knew what they had to do. Some of it is, look, I think I come back to my original point. Be very careful about the information that you're reposting from somebody else, because the information is coming thick and fast about these medications, right? So there is probably a very current research piece on that particular side effect that may not be, that's more current than what you're hearing. And also, like I said, understand that there are other people trying to sell stuff as well. This is a
Mm,
massive market. The
mm,
diet industry is dying or
mm,
is on its way down, and the diet industry is billions and billions and billions of dollars.
mm,
So I think we would be naive to think that there's not financial interests from other areas, not just the pharmaceutical companies that have developed these medications, but there's interests, money interests everywhere. So just
mm,
being really savvy about where you get information, I think, is a really good idea. But overall, I think, I really think these peptides have merit. They are giving people their lives back for some
mm,
people. It allows them to move, live
mm,
life out of
mm,
pain.
mm,
It's a it can be a long haul when you've done a lot from a weight management point of view. And I think the one thing that we forget, not always forget, but we do tend to, in the politically heated debate about whether these things, should be on the market or not on the market, we're losing sight also of the fact that, living with excess adipose tissue, significantly more adipose tissue, comes with its own health problems in its own right. There is uncontrolled inflammation to the point, I personally believe there is a point that the body gets to that is almost unrecoverable with,
mm.
diet and exercise. And I think that's where it's stuck in this endocrine dysfunctional circle that goes round and round and round. And I really feel there's a lot of people in the world that are like that at the
Mm,
moment. So
mm,
I think that these peptides can be quite valuable in trying to cut that circuit of inflammation that's just driving this endocrine dysfunction around and around and around.
I think that's a really good point for practitioners to sit with, especially any practitioner who's never experienced being in a bigger body, or someone who maybe has put on weight but found it easy enough to lose doing, the usual strategies that we all learn. I think it's very easy to sit there and consider that it's the easy way out or the lazy way out, for instance. And I know for me personally, I developed extreme leptin resistance after toxic mold exposure,
Mm.
and having had, a perfect body weight, if there is such a thing as a perfect body weight, but an ideal body composition up until the age of 37, and then stacked on, over 20 kilos in the space of a few months. I know that my entire endocrine system and metabolic responsiveness was completely different with the leptin resistance. And although
Mm.
I've never used a GLP-1, I ended up, because nothing else was working, used the pharmaceutical medication HCG injections. And that was the thing that broke the dam for me and allowed my inflammation to come down, my mitochondrial function to return, my leptin levels to start to fall instead of continuing to rise. And at that point, I was in so much pain. I could barely function, but I certainly couldn't exercise. I, for other reasons related to mold, couldn't breathe properly, so was quite immobilized in addition to the fatigue and the pain that I was experiencing. And I also had very little appetite and was eating very little. It had nothing to do with caloric intake. It was entirely metabolic. And HCG was the gift that allowed me to turn the ship around and
Mm.
actually recover my body composition to the point where I was actually able to return to some normal activity. And then I got my appetite back and was able to eat more protein. And then my fatigue dropped and I was able to actually start, doing resistance exercise
Yes.
again. And I think that's a really important consideration for practitioners who may view things like HCG is a great example, but GLP-1s is another good example as cheating. And I would say, gastric sleeve surgery or liposuction or appetite suppressants, you can certainly look at all of these interventions and think, oh, that's lazy, or it's a bad way of doing things. Now, all of these things have consequences, intended or unintended, of course. And as practitioners, we're always looking for what's underneath. But as you pointed out, this can sometimes be the thing that allows someone to course correct
Mm.
and make it easier to change their choices. Especially because I think that quick win, if you like, can really be very motivating for
Yeah.
people.
Well, I think a win at all can be really
Anyone.
can be
Yeah.
really, really motivating. And I think that's one of the things as well. I don't view these as a quick fix. And that the research is super clear. Like all the trials were a year long. So,
Mm,
we're not talking about putting people on these things for, 6 weeks or 8 weeks, although I know that there are fertility specialists that do that. And that's an
mm, mhm,
entirely different sort of reasoning. But,
mm,
these were not intended to be quick fixes. They were intended to be,
mm,
slower, long term, and they were always supposed to be with adjunct diet and lifestyle.
mm,
Every single one of the trials with semaglutide and tirzepatide, when they were done for weight loss, were done
mm,
in conjunction with diet counseling and lifestyle counseling. In fact, again, coming back to the reason why I'm so passionate about trying to get people before they get on them, the
mm,
most successful arm in the tirzepatide trial had a 12-week lead-in program where they did
mm,
diet and they did diet counseling and did exercise for 12 weeks before they started the tirzepatide, and they got the
mm,
best results out of any single other trial. And I think the
mm,
thing that is not always, when we talk about weight loss with the GLP-1s, they're incredibly anti-inflammatory as well.
mm,
So they reduce a heck of a lot of inflammation of every kind. And it's part of the reason that, they're starting to be looked at for use of so many other things. There's a few cases of lipedema. I've seen one study now of lipedema being treated, and I know anecdotally it's used where it can be in lipedema because that's such an inflammatory
mm,
disease. And again, something very female orientated,
mm,
often, comes with excess adipose tissue, but not always. Cardiovascular disease, the research is
mm,
so clear on that. And very soon, I'm sure we're going to see them independently being prescribed for that. And I think it's really important that people recognize too that the reduction in inflammation wasn't just because they lost weight. Like I know that, like when I've talked to people, they go, "Oh yeah, well, of course, if they lose weight, inflammation is going to reduce." Like these results are independent of weight loss as well. So
mm,
we're looking at a multifaceted approach, and again, I come back to these are naturopathic principles in terms of working on the gut and reducing inflammation. I mean, these are things that I think can help people. But
mm,
yeah, they're not supposed to be short term. They shouldn't
mm,
be short term, and they should absolutely not be rapid weight loss. We should again counsel people against rapid weight loss as well. And that's probably where one of the consequences, sometimes we see gallbladder issues, and that's, any rapid weight loss. We see that
mm,
sometimes with gastric surgery
mm,
as well. So, making sure that people are counseled well at the start
mm,
and they're not viewed as quick fixes. And this is a haul, and this is about a process, and this is about changing, relationships with food. This is about, relearning diet if that's what needs to be. But I think
mm,
we have to recognize there is a body type. Like I work out as a minimum 5 to 6 days a week. I love my time in the gym. I do strength training. I do, anaerobic fitness. I have a
mm,
really good diet. I would still be considered overweight.
mm,
I sleep well. I mean, I've probably got a tiny bit more stress than I need to have
mm,
because hello, life and family.
mm,
But I do all the things. I'm still would be considered in an overweight category.
mm,
So I think recognizing that there are also body types that are not really struggle with the world that we
mhm,
have now. Like it is a
mm,
different world when you think about how we live now
mm,
versus how we lived, even 50 years ago.
mm.
Totally different world.
It sure is a real mismatch, isn't it? Those of us that were programmed to survive famines are
Mhm.
now living in the time of very
Yes,
little activity and, endless availability and access to
I,
food. And,
I say that sometimes in clinic. I,
totally. And then, blue light, not enough sunlight
yes.
during the day. Like there's just so much going on that we're up
Mm,
against. And yeah, I think it's definitely, as you said, it's got a real place to support people to factory reset
mm,
themselves to
yeah.
a better body composition. And as you said, for practitioners whose patients are considering going on a GLP-1, given their doctor is almost certainly not going to be providing this part of the support, looking at the exercise plan. Now, perhaps that might require a referral to a personal trainer, exercise physiologist, something of that nature, but making a plan around how are you going to preserve active tissue mass? How are you going to attempt to build it? How are you going to nourish it, given that your appetite is going to be much smaller than it has been in a way that doesn't sort of sit in your tummy and feel uncomfortable? Nutrition guidelines. How are you covering the bases on their macros given their appetite's going to be down? How are you additionally supporting the micronutrients they won't be ingesting? And of course, there's probably more than this, but including looking at the gut, ensuring their gut health is optimal. They're having at least one bowel motion a day and pre-treating the gut so that you can avoid any kind of sluggishness, a knock-on effect from the medication is such a beautiful place to start an intervention. And if you're lucky enough as a practitioner to get a patient saying to you, I'm thinking about it, or I'm going to do it soon, or I'm flirting with the idea, this is such a lovely opportunity to set someone up for success. And it's very interesting that all of the trials were done in conjunction with nutrition and exercise, and that the ones that got the best results had basically set those people up to succeed in a way that,
Absolutely.
perhaps they haven't been otherwise. So I think that's a great thing to keep in mind. Although I imagine what's happening more often is, in my case, I'm thinking of a particular client who, was 6 months, was in between her appointments, and she came back and was like, surprise, I'm on GLP-1s.
Yeah.
I'm like, oh dear, okay, now we have to, try and recover the muscle mass you've lost. Or you might just have a client presenting for the first time and you see on the list of medications that they're on one of these
Yep.
for however long that they've been on. So if we dive now into like some of those key areas around how we can best support people who are on them,
Mm.
I would love to start with nutrition. And although this might be a little obvious, I'd love to hear it from you. Like, what are the key micronutrients you're like, right, we've got to make sure these are covered?
Absolutely. And I think, almost certainly we'll need to supplement in some shape or description,
Mm,
although it does really depend on how much food drive is
mm,
dialed back. But for
mhm,
each person, some people it's dialed almost completely back and it's non-existent, and some
mm,
people it's just dialed back a little bit.
mm,
In terms of protein, protein really becomes king. No surprise
mm,
there. We're
mhm,
looking at sort of 1.5 grams per kilogram of body weight. But
mhm,
sometimes in ease of trying to just get people to eat, I'm sort of like, we're really looking at like 30 grams kind of 3 times a
mhm,
day.
mhm,
If you're not feeling very hungry, um, I talk to them actually about scheduling food in the same way they would schedule any meeting, because
mhm,
we just have to recognize that the food drive is down. And
mm,
whilst I'm a massive fan, a lot of my background is working with a weight management psychologist for my own health. My
mm,
background is working through intuitive eating and
mm,
listening to your body. I think we have to be really just, it just doesn't work in this case, because if
mhm,
they listen to their body, some of them will never eat. So
mhm,
looking at liquid options, so we're looking at
mm,
collagen here, we're looking at other
mm,
kind of proteins to make sure that our people are ingesting protein, because we really need to reserve that muscle mass.
mm,
It's also just, from a hair point of view, from a skin point of
mm,
view, because nobody wants their hair to fall out and have terrible skin. So
mm.
so that becomes really very important, and you have to work with the person with where they're at. So often it's very simple meals. Monounsaturated fats tend to be nicer on their guts. They tend to not
Mhm,
enjoy high saturated fat foods, and most of them will tell you that
mm,
they try to, like, they had a fatty food and it made them want to vomit, so they
mm,
realize that they can't really eat that. But
mm,
even long term, this is a great way of getting people to sort of work with the kind of diet style we're after. So love to
mm,
trying to get some fiber in there. If it's not possible, then absolutely supplementing with a mixed style of fiber needs to be for bowel motion. But also, if we're long-term thinking about gut microbiome,
mm,
we really want to make sure we're still feeding those butyrate producers so that we can get the short chain fatty acids.
mm,
Like, I think that's super key for long-term, making sure that we're feeding the gut.
mm,
So I do that. I do omega-3s usually as well,
mm,
because, food drive is down. Fish sometimes it's not as palatable, to people. And look, some people don't like fish anyway, like let
mm,
alone if they're on a GLP-1. So often we'll use omega-3, and then I kind of look from there depending upon where they're at. We have an in-depth conversation about what their food drive is, and that sort of really determines my course of action from there. But my big focuses really are on, omega-3, good fats, monounsaturated fats,
Mm.
fiber, and protein, because I'm thinking also of preserving as many other functions as possible. And then we add in as required. Sometimes fatigue is a player, so we'll need a B vitamin,
Mm.
sometimes even a multi, although I very rarely do multis. I just find that mostly we get better results if we're looking at something of a slightly higher dose, more therapeutic, if that makes sense.
Sure.
And then we work from, what else? Herbs wise, are you getting nausea? Where are you
Mm.
at? Of course, all of our beautiful herbs, ginger, as many ginger chewables as you probably can. And they're readily
Mm.
available and not hard to get, preferably not the ones with sugar.
Mm.
Um, Herbs, I think we just need to be careful as well. If there is, slower gastric motility, we just need to be a little bit mindful of
Mm.
half-lives
Mm.
as well. And there's a little bit of sort of research. There's certainly some um, concerns from a pharmaceutical point of view, and there's a little bit of deep diving in how this might impact the half-lives of other drugs that they might be taking. So I think that we should just be cautious with herbs as well. In
Mm.
terms of dosage, let's just be don't I would never and have never high dosed someone on a
Mm.
herb with GLP-1. And
Mm.
where I can be really mindful of their stomach space, right? So if we're putting
Mm.
something in there, then something else might not give. I actually treat them a little bit like the way I sometimes treat my gastric surgery
Mm.
people, in that there's usually limited amount of space. We've got to max
Mm.
everything out.
Mm.
The difference is that, in gastric surgery, there is not that impact sort of from a brain point of view, but there's a really strong impact with GLP-1 RAs on the food drive and the kinds of food. So it can be
Mm.
helpful in some ways, but because there's no food drive in some people, we really have to focus on that.
Mm.
Muscle mass, through movement. I did personal training, I work out, I love weight training. I'm biased. I
Mm.
absolutely admit that I'm biased, but I think, it's really important that we move people into either referral or, there is a bazillion online programs now. I fully
Mhm.
accept, like I lived in a larger body and I can tell you, does it make sense to go into a pool for my joints? Yeah. Would I do it? No, because
Mm.
then everybody's going to see me in a swimsuit in a public
Mm.
area. So,
Mm.
being really mindful about people's body size and pain and the potential of what exercise can and cannot bring them. I was very fortunate in my journey. I had a personal trainer who was, wise beyond her years. She never put me in
Mm.
an uncomfortable position. So I think being really mindful of the human that's in front of you and what's their capacity is
Mm.
important. And hydration, oh my God, hydration
Mm.
is paramount. Given the drive to hydrate will drop. And our
Mm.
thirst cues are not always there because that sits in the part of the brain that can be impacted by the GLP-1 receptor agonist. So it does become a little bit like a job.
Mm.
So I'm upfront with my clients. I'm like, we have to look at this a bit like a job. Your signals are a little bit mixed up at the moment. So we really have to get you in the habit. Again, though, if we get them in the habit, that will bode well for when they want to come off
Mm.
the medications as well. And then doing the things that we do amazingly, like
Mm.
leaning into, while there's space and time, because you'll find that food noise drops a bit. While there's space and time, it's a beautiful time to lead into, what was your relationship like with food?
Mm.
How did you use food? Was it a comfort thing for you? Was it a way that you connected with other
Mm.
people? I think I was telling you in my pre-chat there was, someone who, she had a wine every night, and when we delved, it was because that was the way she spoke to like her husband. That's how they
Mm.
communicated. They had a wine every night together
Mm.
and they talked about their day. That
Mm.
becomes a different treatment strategy than just don't have wine. That becomes, okay, well, maybe you guys need to work out a way to have a conversation
Mm.
without wine. So I
Mm.
think really leaning into, don't be afraid to ask questions about
Mm.
what is people's relationship like with food, and then,
Mm.
sleep, stress, all the beautiful things, because we can set people up for a much easier ride when they finish. And I
Mm.
know I've gone, on a little bit, especially about the gut, because I'm just such a firm, I honestly think it's going to make a difference. I think
Mm.
that we will figure out that what people have in their gut and there's early research to suggest this, what people have in their gut will determine the outcome and the efficacy of the GLP-1 receptor agonist. So it's why I sincerely and passionately want to support gut health. GLP-1 is produced in the gut. We look after our gut, and then we have a much better ride after that.
Yes, this is really powerful strategies for practitioners to consider for sure. And I love that you touched on exploring the person in front of you's relationship with food too, because there could be emotional attachments, they could be using it for boredom reasons, or there's a lack of sweetness or joy or stimulation in their life, and so they're trying to get that from their food. And unless those elements are being supported, as soon as GLP-1s are withdrawn, they're going to go right back to using food as a cheap form of medicine, I suppose, to oversimplify it, and they'll end up just returning to their original baseline.
Yeah.
I do want to touch on, though, because you brought this to my attention, food noise, especially in neurodivergent populations, is like another kettle of fish, so to speak. And you've got some tools in your toolkit around that. Can you walk us through like what's going on there and how you overcome it?
Yeah, and look, it's a multifaceted approach. But when I was going through my journey, I was very fortunate to meet a weight management psychologist who essentially changed my life. And I ended up working for him as well. I trained some of his clients. And so he really was wonderful in terms of tools that he gave me, and he's more than happy for me to share them. I checked today. So some of the things that we do, he also works with the neurodivergent population as well. And where it sort of becomes a food noise for our neurodivergent population, self-included, there's an afternoon, especially an afternoon, it's a very dopamine-y kind of picture. So there's not hunger, there's not a need to eat in terms of signaling, but the signaling, there's a signaling that's happening, and sometimes that sensory component is not being read to whatever it is, right? So in the effort of trying to figure out what it is that they need, eating can be one of those things, because chewing, first of all, is a very sensory stimulating exercise. Anybody who's got, autistic people in their life will know that. I have an autistic son, and one of the things that we really struggled with is, and still do, we have to have chew toys and make sure that he's got access to that, because it's quite sensory soothing, but also just that act of eating releases chemicals, right? That's why we can have emotional eating dysregulation, because just we're drawn to food. If we didn't get a buzz from food, we would have been extinct millions of years ago, because there would have been no drive to actually eat. So when we are, when there's a bit of sensory dysregulation and our neurochemistry is not as balanced as we would like, for want of better expression, food is one of the things that will get driven to, because all your brain wants to do is make you feel good. Its whole purpose in life is to make you feel good and keep you alive. And so food is one of the things that'll search the memory bank and it'll go, ding, oh, this thing, that made us feel good in the moment, so we're going to go do that. So the way that I approach it is that we do like a check-in, a mind-body check-in, right? And this is the things that, Glenn taught me. Are you hungry? Do you actually need to move instead? Are you thirsty? And it's taking the 10 seconds before we eat to do a full body check-in. Am I tired? Do I actually need to move, especially for our neurodivergent population? Do I need to move? Checking in, is this really hunger, or is there some other drive? And it doesn't work all the time, Amy, but it does work. And sometimes I say to people, if it works 50% of the time, that's 50% of the time. We're changing neural pathways, because once that pathway is built in regards to, I ate that, I get that brain chemistry, brain remembers, reward pathway goes around and around and around and around. So anything that we can do to stop that reward pathway going around and around gives us an opportunity to rewire ourselves. And that's the work that I did, with Glenn, was to try and rewire where my brain was at, because I was that person. I ate in a car in secret because it made me feel better. I was the person that would, go to the bakery and get the family a loaf of bread and buy a cookie and like eat it by the time I got home. So
Mm-hmm.
I resonated with a lot of that emotional eating capacity. So we'll all eat emotionally. It
Mm-hmm.
only really becomes more of an issue if it is a way that we manage uncomfortable feelings. That is then how we need to address that, because that just builds pathways that go round and around and around. It's very difficult then. And that's, we see it all the time. That's the glass of wine while I'm getting
Mm-hmm.
dinner because that's my signal to relax.
Mm-hmm.
That's the muffin that I have because that makes me feel good. That's the procrastinating before I'm just about to study, right?
Mm-hmm.
I finished uni last year and I can tell you there was a bit of procrastinating in that. Boredom and a reward. My gosh, the amount of people, I've had a hard day.
Mm-hmm.
Absolutely, you deserve a reward. You bet. Is it food?
Mm-hmm.
I don't know, right? I don't think so.
Mm-hmm.
So that was a long answer, and it wasn't just specific to our neurodivergent population. But I also,
Mm-hmm.
let's look at what's the neurochemistry.
Mm-hmm.
What's that saying? Is there something that we can do in terms of even supplements for
Mm-hmm.
that? I love L-theanine, I love passion flower, I love mag-threonate. Some of those can be really beautiful in combination with some skills to go, like I call it a stop check-in. And again, that's something that Glenn has shown me. It's the stop, think about it, just put the 3 seconds of that prefrontal cortex thought strategy reasoning to
Mm-hmm.
kind of prevent that circuit of that amygdala response. I use some tapping here as well.
Mm-hmm.
And look, I think there's other people that have got some extra skills as well. I know a couple of hypnotherapists. If you've got another, modality, great. But you don't have to. I think it's very much about, again, leaning into
Mm-hmm.
what's the relationship? What is it? Was it giving that person? If you can get them to stop, and sometimes that's visual reminders, sometimes that's reminders on phones. Visual
Mm-hmm.
reminders can be really helpful because they're almost like exactly like stop, circuit breaks the amygdala, prefrontal cortex kicks in.
Mm-hmm.
Ah, okay, actually, no, this is not furthering my goals, and I'm actually thirsty, or
Mm-hmm.
I'm bored,
Mm-hmm.
or I'm something else. It was kind of a
Overwhelmed.
long answer, wasn't it?
No, I think it was really thorough because this is an area, certainly, first of all, great idea to refer to a psychologist, someone who specializes in sort of weight loss and food psychology, because it is really complex and it is
Mm,
really nuanced, as you've clearly illustrated for us. But also, it is helpful from a practitioner point of view to at least start that conversation, find out if people have any awareness around their triggers and what it is
mm,
they reach for and what might be behind it. I mean, just speaking from personal experience, whenever I'm really stressed and adrenally fatigued, I'll crave salt and vinegar chips. And it's the salt that my
absolutely.
adrenals are looking for. And so when I started leaning on electrolytes more, and actually, well, first of all, not burning myself out to the point where my adrenals were like, give me the salt and
Well,
vinegar
there is
chips.
that, yes.
Yeah, step number one. But also, if I'm going to flog myself, like extra magnesium,
Mm,
extra electrolytes, scheduling rest, if I'm having a heavy day like today, have a lighter day
mm,
tomorrow instead of just trying to continue to operate on top of just, feeling a little worn out. And really identifying those triggers if someone's, yeah, anxious and it's a way of avoiding tackling what's bothering them or feeling overwhelmed and, all of that kind of stuff. And even just starting that conversation, even if you don't necessarily peg it down to an exact answer or have an
mm,
exact strategy, it allows your patient to begin to actually observe themselves and come out of the experience and gives them another opportunity for a way to leverage themselves. And
mm,
this actually happened to me somewhat recently. I've never had a tricky relationship with food. I feel very blessed to have avoided developing a really unhealthy relationship with food. But I have also always really liked to entertain. And I remember a colleague of mine said to me, she's very pragmatic and very dry. I'm not saying this is right or wrong or me, but she was like, food is just fuel. You should be just thinking about it from a like just literally what does your body need and everything else is superfluous. And I was like, clutched my pearls. I'm like, I beg your pardon. Like, I want my food to be delicious and stimulating and, all the rest of it,
Yeah.
as well as nutritious and good for me. And that sort of led me down the rabbit hole of, making healthier versions of recipes of things that are not necessarily that great for us. However, I had a really interesting experience in the last few months. I have become really engaged in a project and it's feeding me creatively and it's lighting me up and it must be giving me dopamine and other great neurochemicals.
Hmm.
And for the first time, I felt a shift in actually how I related to food. It was not even an emotional shift, but I was being nourished by something outside of myself and my interest in my food being, beautifully aesthetically pleasing and an amazing, delicious culinary thing, as well as being nutritionally complete, became less important. And I was able to kind of eat a plainer meal and not feel like, oh, I'm missing out. And it was just really curious to, even for me, who's not had an issue with food like that, to notice the shift when I'm being nourished and stimulated elsewhere. And I think there's something in that for everybody, really. A lack of sweetness in our life will lead us to craving it in our food
Yeah,
and so on.
absolutely. And there's so much background to food as well. For me personally, what I recognize is actually when I feel joy, which is, quite contrary to
Mm,
what Hollywood would tell you,
mhm,
because that was what my background and family was. When people got
mm,
together, we ate
mm,
and drank too much. And
mhm,
so when I was happy, I immediately associated with, well, I eat and drink too
mhm,
much until
mhm,
it was actually quite blunt that someone said to me, well, why do you like happy and you're rewarding yourself like you're not
mm,
a dog. So why would you
mm.
reward yourself with food? And it really took me back. And I'm like, oh my God, they're true. That's exactly
Yes.
right.
Well, it doesn't have to be a food-based reward, but I think
Exactly.
it's the easy, it's like the lowest hanging fruit,
Fruit.
if you
Yeah.
like. It's accessible.
Yeah.
And I think in some ways, as small children, our parents probably also placated us and rewarded us
Sometimes,
with
yeah.
little treats. And so the habit gets established very early on and can be very much a subconscious thing.
Absolutely. And it brings us out to, it's not just we need to move past that it's food and movement is the only solution
Yeah.
to this. We absolutely have to move past that, and we have to move
Mm,
past the moral judgment of someone who lives in a larger body. Because
hmm
when we look at what the determining factors are to someone's body size, like in 2007, the British government did a foresight program that put health professionals together to map. Like to do like a system map of obesity. This was
mm,
2007, right? So a
mm,
fair while ago. And
mm,
they came up with 7 subheadings of only 2 were personally associated to that individual, which was, that
mm,
individual diet and individual movement. The rest was the environment in which they're in, food
mm,
wise, the
mm,
psychology environment that they're in, the exercise environment that they're in, our food production as well, in
mm.
addition to their physiology. So I think, we do need to think, I actually use that as a bit of a guide in my, holistic treatment of people is like, what is the
Mm,
environment that they're in, both movement, and social.
mm,
What's the physiology of the person I'm looking at? There is a body type
mm,
that will gain weight super quick. I am that body type,
mm,
and I've got mates who are the absolute opposite and can
mhm,
shove stuff down their face like
mhm,
they would not believe. And they
mhm,
look at what I eat and they're like, man,
mm,
you should be like that. And I'm like,
mhm,
right, well, I'm not.
mhm,
So that's
mhm,
fine too.
mm,
So we can use that framework as the way that we can help our clients if we're looking, zoom out and look at everything around their
mm.
life as well, which is again something that I'm, super passionate about. And I think,
Yeah.
recognizing the difference between male and female physiology becomes very
Mm,
important too, because
mm,
estrogen has a really big impact in this game
mm,
as well. And
mm,
we know that it
mm,
actually impacts the efficacy of GLP-1
mm,
receptor agonists too. So premenopausal
mm,
women will have a better response than postmenopausal women.
mm. Wow. This is just such an in-depth conversation. And I think one of the big takeaways I'm getting from this is when you take that holistic approach, especially if you can apply it prior to
Mm.
going on to GLP-1s, but especially also during, you can really set someone up for success not only while they're on it, but I think post GLP-1. And this is another conversation that as we get into the end of the podcast, we should probably have, and
Let's
that
do that.
is, what is the exit runway for someone wanting
Mm.
to come off them? I think people, like many other medications, are so excited to go on something, feel better, get a result. They don't actually look at the next step beyond that as like, how do I come off this and how do I maintain my results? How do I feel good? So, can you run us through like what you would consider to be the best practice according to the evidence we have and your clinical experience?
Mm. Yeah, there's actually not much evidence actually in regards to people coming off them, unsurprisingly, because I
Mm,
think there's a push to not come off them from a medical point of view. So what I've done is collected bits and pieces of studies that I've found, arms of studies that I've found as well, and
mm,
then equated it with things that we know. So there was an arm in one of the tirzepatide trials, and they had people come off them. They revisited them 12 months after. So the
mm,
arm that maintained diet and lifestyle regained weight far less. Like it was quite a small regain of weight. The
mm.
arm that did, nothing went back to the way that they were,
Sure.
regained, at least a third of their body weight, if not more. Oh
Mm,
my God, what a surprise.
mm,
So what I've read also is there's a couple of European clinics that have done this really well. So they have this taper off program. And
mm,
so they never just stop people. So as they were stepping up with dosages with both the semaglutides and the tirzepatides, this European clinic starts to step people down. So they
mm,
actually do it as like a 9 to 10 week process. And I personally think that's a really intelligent idea because you can start to see when things are coming back, right? Like, so
mm,
is hunger coming back? Then all right, let's spend some time at this particular level, because
mm,
is it actually hunger or is it food noise? So
mm,
let's explore where our hunger and fullness signals again as well,
mm,
because there are some people that are interpreting food noise as hunger, and there are some people that are interpreting hunger as food noise as well. Like, it's okay to be
mm,
hungry.
mm,
Like, that's a normal physiological response. So if you do a step down, then you can address each thing as it arises, and you can prep people in a far better way. So
mm,
obviously, protein, fiber, saturated, like unsaturated fats, limiting saturated fats from a gut perspective,
mm,
because we can get our own GLP-1 working better if we have that kind of diet. Very Mediterranean style, really,
mm,
is what
mm,
we're looking at there. But outside that, when things pop up, right? So has the food noise come back? Okay, what's at the bottom
mm,
of that? Have we addressed emotional eating? But that does seem to be the best evidence, but there is not much, let me tell
mm,
you.
mm,
The other thing that I always look at is our sports nutrition mates, right? Like, they've actually
mm,
been doing this for a bit.
mm,
They've been doing, the whole let's lose weight, let's lose, fat mass while we're maintaining muscle mass for a long time. That's what bodybuilders do. So
mm,
if we're able to, do a much more graduated approach where we're looking at food, looking at sleep, looking at inflammation, really repairing the gut, simple things like chewing 30 times before
mm,
you actually swallow will increase your own GLP-1, which still has great impacts in your body, even if it is degraded by, DPP-4.
mm,
Make sure you've got good protein. That's actually the things that we know.
mm,
But the runway can definitely be there, especially if you've done the prep work, you've done the
mm,
work like during,
mm,
the work after becomes easier. The work after becomes much, much harder if there has been rapid weight loss, if there's
mm,
been no nutritional support, because almost inevitably there has been enormous muscle mass lost, and
mm,
we've probably put that person in a poorer metabolic position. So that
mm,
is, again, passion that drives me is to try and get people well before this time, because there is good evidence if this is done, consistently. And this might be quite controversial, but I liken it a little bit like, and this is going to be very controversial, and I apologize. So in Alcoholics Anonymous, one of the things that they do is that you need to go to a meeting regularly and you need to stay accountable regularly. And I do think that when you have lived in a significantly larger body with an aberrant metabolic system, when you
mm,
come off these things, there has to be regular check-ins for an extended period of time. If we
mm,
transfer what we know about people who have lost big amounts of weight, whether it be through GLP-1s or bariatric surgery, we know that the successful people that maintain weight loss are those that have some kind of regular check-ins, whether it be a
mm,
health professional or a group or something that they do, but it is one prioritized in their life
Mm,
because there have been
mm,
studies on this, prioritized in their life, and they are engaging on a regular basis with someone who keeps this upper mind of their mind. And the reason I bring in the association, like, as I appreciate it's quite controversial. So I live with a recovering alcoholic, and we've talked many times
mm,
about, isn't it interesting, the philosophy of being able to maintain weight loss without being crazy and living with the diet culture, but just
mm,
making sure that food and movement is uppermost in mind. You
mm,
know, and he talks about the things that they do in terms of, making sure that they are accountable for their actions every day, and,
mm,
that they are aware of what their triggers are and they're actively working towards them. So I think we can take that sort of approach, but without the bigness associated with it,
mm.
and work through helping our clients, put themselves in an environment for success. Like, if you don't put any priority into this, hell yes, it's going to go back to where it was.
Absolutely. And I think not that you can compare addictions or coping mechanisms to one another. However, alcohol is not essential for life. Heroin is not essential for
No,
life. You can live without those things for the rest of your life. Food, you have to keep eating if you want to stay alive. And I think
absolutely.
being forced, face to face with something that if you have had challenges with your relationship with food or your appetite in the past, can be really tricky, but that makes perfect sense that regular support, regular check-ins, regular pep talks make all the difference. And it's like anything in life, who you surround yourself with can be really make or break how your life ends up turning out. And with
Mm.
health, it's no different. And certainly in the case of this, it's just like any other health challenge. You deserve that support and to really prioritize that focus for yourself too. And GLP-1s aren't the easy way out at all. It comes with many different challenges, which means if you really want to hang on to the results that you've got, like preparing well for it makes all the difference. Holistic support during it also makes all the difference. And then preparing the exit and navigating that gently and kindly also is
Gently and
powerful.
kindly
Mm,
is a beautiful, beautiful way of putting this, because I think, let's go back to, there's a
mm,
cohort here that have felt very stigmatized in the past.
mm,
And this is an opportunity. This is an
mm.
opportunity where, we can really help a bunch of people that have not wanted to be helped before.
Oh my gosh. Well, this has just been the most amazing conversation, Wendy. Thank you. And I want to just point out a couple of things for anyone who's interested in connecting with Wendy. You can find her on Instagram at GLP-1 support naturopath. And she's building a lovely community over there. So whether you're a practitioner who wants to learn more, or you are someone who's using GLP-1s, whether you're a practitioner or not, that is a wonderful place for you to go. And I will just briefly mention, and please DM Wendy for more information about this, but she is putting together a pilot program looking at gut bacteria, or the difference between gut bacteria between those who respond well to GLP-1s versus those that don't, and actually correcting the issues that she's noticed and supporting people to respond better to that medication. So I will absolutely link your Instagram account, Wendy,
Thank
so
you.
people can find you and learn more from you, and of course connect over that pilot program if that's of interest to them. But I want to just say thank you for sharing your wisdom and experience, and also such an incredibly empowering structure for practitioners to consider when it comes to supporting patients. It was an honor to chat with you today.
I have loved chatting with you, and I just really hope it helps. That's all I want to
Mm,
do. I just want to help people, help practitioners, and then if
mm.
practitioners know, then they can help more people.
Yeah, absolutely. And you're right. This is the era of GLP-1, so we either need to learn properly what to do or be left behind,
Yeah,
really.
260 are currently in some sort of
Mm,
trial.
mm-hmm.
So there's more
Mm.
coming.
There's more coming. Well, I think I speak for everybody who's heard this podcast today, and that we thank you for getting us across these really important aspects of that. And to everyone who tuned in today, thank you so much for listening. Also, remember you can find all of the show notes and our other podcasts at the Designs for Health Australia website. I'm Amy Skilton, and this is Wellness by Designs.